Respiratory viruses have long influenced human history, shaping our understanding of diseases and inspiring advancements in medicine. Today, we focus on two significant respiratory viruses: Human Metapneumovirus, HMPV, and COVID-19. Both have left an undeniable mark on global health, yet each in unique ways. Did you know that COVID-19, caused by SARS-CoV-2, became a global pandemic within months of its emergence? Meanwhile, HMPV, discovered in 2001, has quietly affected millions without drawing the same level of attention. Today, we'll uncover their differences, similarities, and what this means for public health. Don't forget to like, share, and subscribe to support us in bringing more engaging content to you. First, let's understand HMPV. Discovered relatively recently in 2001, this virus is part of the paramyxovirus family. It primarily affects the respiratory system, leading to symptoms like cough, fever, nasal congestion, and wheezing. While anyone can contract HMPV, it poses the greatest risk to young children, the elderly, and immunocompromised individuals. HMPV spreads through respiratory droplets, similar to other common viruses like influenza. Most infections occur during late winter or spring, and reinfections are common throughout life. Despite its prevalence, public awareness about HMPV remains low. In contrast, COVID-19, caused by SARS-CoV-2, emerged in late 2019 and rapidly spread. Globally, it belongs to the coronavirus family, which includes viruses responsible for diseases like SARS and MERS. COVID-19 symptoms range from mild, such as fever and fatigue, to severe, including pneumonia and multi-organ failure. The virus's ability to spread through both droplets and airborne particles makes it highly contagious. Moreover, SARS-CoV-2 introduced unique challenges such as long COVID, where symptoms persist for weeks or months after initial recovery. These differences highlight the distinctive nature of each virus. Despite their differences, HMPV and COVID-19 share notable similarities. Both are respiratory viruses that primarily affect the lungs and airways. They spread through respiratory droplets, emphasizing the importance of hygiene practices like hand washing and mask wearing. Both viruses disproportionately impact vulnerable populations. Children, the elderly, and individuals with underlying health conditions are at higher risk of severe illness. Symptoms such as cough, fever, and difficulty breathing are common to both, making differential diagnosis challenging without specific testing. Additionally, both viruses highlight the interconnectedness of global health. Outbreaks of HMPV and COVID-19 demonstrate how respiratory illnesses can strain healthcare systems and underscore the importance of preparedness. Preventing respiratory infections begins with simple measures. For HMPV, maintaining good hand hygiene, avoiding close contact with infected individuals, and using masks in healthcare settings are effective strategies. Public awareness campaigns could further reduce transmission, especially during peak seasons. For COVID-19, vaccination remains the cornerstone of prevention. Booster doses are crucial for maintaining immunity, particularly against emerging variants. Social distancing, wearing masks in crowded spaces, and adhering to testing and isolation protocols also play vital roles in controlling the spread. Education is essential for both viruses. Public health initiatives should focus on equipping individuals with knowledge about transmission, symptoms, and preventive measures. Empowering communities to take proactive steps can mitigate the impact of these viruses. Research into HMPV is gaining momentum, with scientists exploring potential vaccines and improved diagnostic methods. Advances in understanding the virus's structure and replication could lead to targeted therapies in the future. For COVID-19, research is more expansive, addressing issues like vaccine efficacy, long COVID, and new treatments. Innovations in mRNA technology, initially developed for COVID-19 vaccines, may pave the way for breakthroughs in other areas of medicine. Global surveillance systems are critical for both viruses. Monitoring genetic mutations and tracking outbreaks can inform public health strategies. and prevent large-scale epidemics. Collaboration between governments, researchers, and healthcare organizations will be key to future preparedness. The healthcare system plays a pivotal role in managing outbreaks of respiratory viruses. For HMPV, early diagnosis and supportive care are essential to prevent complications in vulnerable groups. Strengthening pediatric and elderly care units can enhance outcomes. In contrast, COVID-19 exposed gaps in healthcare infrastructure worldwide, overwhelmed ICUs, shortages of medical supplies, and overworked staff underscored the need for robust pandemic preparedness. Investments in telemedicine, rapid diagnostics, and training programs for healthcare workers have become priorities. Both viruses highlight the importance of global cooperation. Sharing data, resources, and expertise across borders can improve response times and save lives. In conclusion, HMPV and COVID-19 exemplify the diverse challenges posed by respiratory viruses. While they share commonalities, their differences in severity, global impact, and available treatments highlight the need for tailored approaches. Understanding these viruses not only aids in prevention, but also emphasizes the importance of scientific research and public health measures. By staying informed and proactive, we can protect ourselves and contribute to a healthier future. Thank you for joining us on this journey of exploration. Stay safe, stay curious, and let's continue learning together here at Edvora. Don't forget to like, share, and subscribe for more exciting educational content.